Welcome to Inside Maine Healthcare. I'm Joel Allenbaugh. Well, joining us today is a panel of folks, representatives from Sweetser, Spurwink, and Martins Point, talking about an endeavor where they're integrating a behavioral health specialist in the primary care offices at Martins Point. Stay with us.
Inside Maine Healthcare is Maine's only show dedicated to healthcare in Maine, brought to you by the healthcare industry and business leaders. Inside Maine Healthcare will bring you the practical information you need to understand what is driving our healthcare costs and identify the resources available for you to better manage your own healthcare. Learn how healthcare reform, new laws, and policymakers impact Maine business and consumers. Find out what business can do to offer affordable, comprehensive healthcare. Join us as we discover and implement innovative solutions to Maine's complex healthcare challenges to provide Maine people more affordable, sustainable, results-driven healthcare.
MaineSense is not just health insurance. This is a new program based on reducing health insurance costs.
The costs were just too expensive. I couldn't put that on my employees with those type of premiums.
MaineSense is unique because it's an employer-owned health insurance company.
It's the kind of plan that I'd always dreamed of being available.
While companies across the country struggle with the rising costs of providing health insurance to their employees, Maine employers are taking action.
Well, I think all the other health insurance companies we've been with over the years have brought to us reduced benefits for higher premium, and our employees are looking for something more than that.
MaineSense is a health insurance program developed and owned by Maine employers in partnership with Martins Point Healthcare.
This is the first time I'd heard of a health insurance program that aligned the interests of employees, employers, and the healthcare providers.
It is a plan designed around preventive care and reducing the overall cost of healthcare by keeping people healthier, keeping their health insurance dollars in their pockets.
I feel that going with MaineSense has empowered our employees. It's given them the tools to make the best healthcare decisions for themselves.
These and other Maine employers are taking a new approach to health insurance. Find out how to join them at mainsense.org.
I think MaineSense is right for companies that want to take a proactive approach to managing healthcare costs.
This is a win-win for everybody, and we're really excited and looking forward to making this happen throughout our organization.
Welcome back to Inside Maine Healthcare. Well, let me start with introductions. I'm going to try to get this right. So to my left, Cindy Fagan, who is Vice President for Programs at Sweetser. And to my right, Cynthia Dodge, who Director of Clinical Services at Spurwink.
Nice to meet you.
And nice to have you here. And then finally, all the way to the right, Tom Polko, am I pronouncing that right?
Correct.
Who is Vice President for Specialty and Ancillary Services with Martins Point.
Correct.
So I asked you all to come and chat today. I know that there is an initiative that you're rolling out currently, a partnership with Martins Point, who is a primary care group, with Sweetser and Spurwink. And why don't I stop there and let one of you pick it up? Maybe I'll go to you, Tom. And maybe just sort of tell the audience what the program is all about, what the partnership is.
Perfect. We're great. Martins Point is really looking at a co-location model and a partnership with both organizations to help take care of our behavioral health care patient needs. And working in a co-location model so that our primary care docs can work with behavioral health providers to care for our patients in our offices within Martins Point.
So when you say co-location, you're talking about a behavioral specialist, let's say from Spurwink, is physically located in the office of a primary care physician with Martins Point.
Absolutely, so that when a patient comes in and we identify that they could use some help from a behavioral health specialist, the doctor can even have a warm handoff and have that patient go and see the behavioral health specialist, or at least meet the behavioral health specialist that day, so that the likelihood of them coming back and talking to that patient is much higher.
And so if you had to encapsulate, and I'll come to you next, Cindy, what would you say is the reason for this initiative?
Well,
or the objective, I might say.
I think the initial reason is because you have three organizations that are committed to improving health outcomes for Mainers. And Martins Point has taken the initiative to reach out to Spurwink and Sweetser and to discuss with us how to place that behavioral health specialist right there with their primary care providers, so that patients that would usually not have access to this resource will have access to it right in their primary care provider's office.
That's a good point. So let's say that this model doesn't exist. You say they would not have access to this resource. What would the access be? What would it look like for someone absent this type of a relationship?
What this opportunity has afforded us is a seamless experience for the patient so that they're able to go to a place that's familiar. There is still a stigma that is pervasive around behavioral health, emotional health, mental health kinds of issues. So prior to this, someone would have to seek out a provider either in a community mental health setting similar to either of our organizations or a private practice kind of model that was apart from, and that would lead to that provider having to do the coordination of services outside of their own realm in order to make sure that there's a holistic perspective. And this has afforded us that opportunity for the patient's experience.
Actually, nationally, we know that 80% of folks who have an issue that could be helped by a behavioral health intervention only talk to their primary care practitioner.
So they're not seeking out that care.
Right, they never walk through the door of a specialty clinic, which is what we have at this point in time, and this will allow that 80% of patients the opportunity.
And it will actually help the patient because they'll be getting the specialty care that they need from the behavioral health provider, but also the primary care that they need from our physicians and mid-level providers in the practice.
And I would expect that when you talk about life, when I think of a primary care physician, they're sort of looking at the medical issues. I would think that there is a strong correlation between the behavioral health issues and the physical potential issues. Is that a safe assumption?
Absolutely. You can't bifurcate that this is your emotional being and this is your physical being. One impacts the other, and it's often hard to figure out which comes first.
So having the two together in the same place allows us to be able to care for the whole person within Martin's Point, that both their behavioral health needs and their physical health needs. Is
this something that the three organizations have done before, or is this is a new territory?
It's a little bit of both. I think the organizations, and they can speak to what they've done, but Martin's Point, actually, in two of our offices, we have a behavioral health specialist that is in the office. But this is a new and different model where we can partner with people in the specialists in our communities to be able to do that. And they can continue to work with other providers in the community that patients can still see. But this is the first time that, from our perspective, that we've been able to work with the organizations to bring them in.
And I asked the question because sitting here as sort of a layman, it seems fairly obvious that integration would have the opportunity to prevent better care. But I'm guessing that we don't have to guess that there's some evidence that shows that, look, when you pull these resources together, you're going to get better outcomes for patients. Is that safe to say?
Yes, that's the hypothesis, and across the country we see this happening, this co-location of behavioral health with primary care. However, even though it seems obvious, we're talking about two cultures coming together in a different way and learning about each other and learning how to work on behalf of that patient's health outcomes.
Sounds like you have to have the right partners.
Absolutely, which we do.
Which is why all three of us are here today.
Yeah. And when you look at how this is rolling out, where are we in the process? Is this happening today? If I'm a patient of a Martin's Point practitioner and I walk in for a visit, am I going to see that behavioral health specialist today?
Not quite today. We're looking to begin in July. We have had, as we were talking about even earlier, we've had lots of meetings getting ready for this and getting prepped for this. We have some time still to go until July when we can actually have the providers in the practice to begin to do that so that they can see the Martin's Point patients. So this is something for Martin's Point patients. We're starting in 4 of our health centers, and then we'll expand so that we're in all 9 of our health centers eventually, but we're piloting this in 4 of our health centers in Portland, South Portland, and our 2 Brunswick sites, the Baraboo Road and the Farley Road sites.
So when you talk about these sort of different cultures coming together and having to sort of get comfortable with one another, what are you getting for feedback so far? Maybe from your specialists as well as from the primary care. Are folks susceptible?
We are engaged in a very intense creation of the architecture and infrastructure to support this, because it's really beyond just someone being located in the Martins Point setting. It's how to integrate one of our providers fully into the team and the experience so that there's a flow of records, documentation, and the system is not completely set to support that. So we're having to create workarounds to make sure that when we do have the launch, it's the right fit, interviewing teams that are representative of all of our agencies and sectors. So we really want to start this off right. So a lot of thought.
So we're about the end of our time for our first segment, so we'll wrap and we'll come back and talk more. But 2 things that you just said that I think will lead us into our next segment, which you mentioned team, which makes me think of the medical home model, and then you talked about things aren't quite set up for this type of a model, which starts to lead me into the whole conversation of payment reform. Maybe we can touch on some of those things when we come back. Well, thank you all. Stay with us. We'll be right back. Are you concerned about the impact of rising healthcare costs on your business? Hello, I'm Joel Allenbaugh with National Worksite Benefit Group. Confused by the ever-changing laws, regulations, and compliance requirements? Struggling to educate your employees on the details of your benefits program? Let our recognized experts at NWBG take the stress and frustration out of these complex issues for you, so you can focus on building your business. Go to our website or give us a call today for a free consultation.
Maine Sense is not just health insurance. This is a new program based on reducing health insurance costs.
The costs were just too expensive. I couldn't put that on my employees with those type of premiums.
Maine Sense is unique because it's an employer-owned health insurance company.
It's the kind of plan that I'd always dreamed of being available.
While companies across the country struggle with the rising costs of providing health insurance to their employees, Maine employers are taking action.
Well, I think all the other health insurance companies we've been with over the years have brought to us reduced benefits for higher premium, and our employees are looking for something more than that.
Maine Sense is a health insurance program developed and owned by Maine employers in partnership with Martins Point Healthcare.
This is the first time I'd heard of a health insurance program that aligned the interests of employees, employers, and the healthcare providers.
It is a plan designed around preventive care and reducing the overall cost of health care by keeping people healthier, keeping their health insurance dollars in their pockets.
I feel that going with Maine Sense has empowered our employees. It's given them the tools to make the best healthcare decisions for themselves.
These and other Maine employers are taking a new approach to health insurance. Find out how to join them at mainsense.org.
I think Maine Sense is right for companies that want to take a proactive approach to managing healthcare costs.
This is a win-win for everybody, and we're really excited and looking forward to making this happen throughout our organization.
Hi, I'm Denise Dumont-Bernier, the Director of Workplace Health. Do you want to work with a team of trusted occupational health specialists with many years of combined experience and proven results?
I would recommend Workplace Health because they have high-quality programs and people. They deliver what they promise, they care about our employees.
Do you want a healthier and more productive workforce?
CMALMI has reduced its workers' compensation premium by 60% in the last 3 years.
Our employee wellness program, which is run by Workplace Health, has kept our healthcare costs flat for over 3 years. This has saved millions of dollars for Maine General Health and all of our employees.
You will get timely appointments for your pre-placement or DOT physicals. You can expect direct contact with our doctors and nurses and emailed results immediately following care at our practices. Join hundreds of other businesses in the Greater Kennebec Valley and call Workplace Health, a department of Maine General Medical Center, to be your partner in health.
Thanks for staying with us. Welcome back to Inside Maine Healthcare. Well, we were talking before the break about this partnership with Sweetser and Spurwink and Martin's Point, really integrating behavioral health specialists in the primary care office. And I think we touched on some of the advantages, especially for the patients in coordinating that care. There's this whole movement that we're seeing to try to take primary care and make them more of a central role in healthcare delivery. And I keep hearing the term patient-centered medical home. And this whole concept of a team approach. And maybe I'll start with you, Tom, and just speak to maybe maybe the reaction of your physicians in this, and how are they feeling about this, and how does this tie in?
They're very excited about this. They've actually been the ones to kind of initiate this and asking for this type of service, and just as you said, to get into kind of taking care of the whole patient and the whole patient-centered medical home. This allows others to be part of the team to help care for the whole patient.
How do you, if you, let's say that I'm one of those people who does have a behavioral health specialist who I'm working with, and I happen to also have a Martin's Point primary care physician. But let's say that my specialist doesn't happen to be a Spurwink or Sweetser specialist. Where does that put me as a patient?
Well, if you have a positive relationship with that behavioral health provider in your community, we do not want to disrupt it. In fact, if there's any way that we can assist it strengthening, we'll work with you around that issue, because we're really focusing on what the primary care provider thinks we could do to help your health improve. So if that's something we can communicate to your provider in the community, we'd want to do that. But we're not interested in disrupting positive relationships.
And we're actually hoping that this will enhance some of those relationships, because more people are getting the care that they need, and there will be more care to be provided within the community also.
Yes.
One of the things we've been finding is, I think it's pretty obvious that the payment model around healthcare delivery is, let's just say, has some challenges. And it, to get to a different place, which I think everyone recognizes we need to get to, that's fairly easy to sort of visualize what it should be like. But to get from here to there is a totally different challenge to face. And when I think of a primary care practice or a behavioral health specialist who's getting paid through so many different resources, it might be a patient who's on state aid and under the Medicaid program. It might be a patient who's over 65 who's on Medicare. It might be someone with any number of private insurance plans. You mentioned that the payment models are not necessarily geared toward this type of an effort and a system. How do you reconcile that? How do you?
I think that's a hallmark of the uniqueness of this endeavor, that this is not something that others have not done, but they have done it with the support of pilot grants and startup funding to support what doesn't fit into a typical fee-for-service model. We've decided to come together that this is important for the patient experience, and to be able to have outcome measures that will demonstrate that, in spite of a system that is a square peg in a round hole kind of thing. Because many of the endeavors that we'll use to support the patient as coordination of care, if there is another provider, we'll make sure that that information flows and that it fits with what our goal is. Those are not reimbursable events. So it really is our own commitments to this experience, and to be able to demonstrate that it's effective, that we're all here.
And our hope is that if we do this right and the patient gets the best care from the best provider at the right time, that it will overall lower the cost of care, which is one of the hallmarks of Martin's Point, is to overall lower the cost of health care.
And we're hoping that many of the patients that we've seen that don't have good primary care relationships often, that group of folks is also going to find their medical home, and that this will make it more possible for folks with a serious mental illness to also be part of receiving care the way we receive it. So that's one of the goals that we have as well.
And if the model works, which it sounds like it has certainly a lot of opportunity to, maybe the payments will begin to recognize that model and the efficiency of it and change to support those types of models, and it'll expand beyond this relationship.
We certainly hope
we
so.
hope so.
And we want to demonstrate that through our outcomes and a unified approach so that we can capture this information and perhaps do some persuasiveness about the payment reform.
Yeah. And we can be a model for other people to look at and say, would like to do that same kind of approach from a primary care perspective.
Yes.
So, I mean, it sounds like a lot of benefits at the patient level. Right. Any resistance at the patient level? So you talked about sort of the stigma and the ability to come into an environment that they're comfortable with to help remove some of those barriers. Is there a flip side of that? Does it create barriers for someone who maybe gets uncomfortable with that dynamic, or have you sensed that at all?
I don't think that we've sensed that at all, and I think it's taking down the barriers, as you said.
Yeah, and I also think that because the behavioral health specialist is being introduced to the patient by their primary care provider, a relationship of trust there that gets passed on to us, it's more likely that that connection is going to be made. But it is patient choice.
Absolutely.
So
the patient will always be able to decide that they would like to take part in this kind of a program or not, and continue to just see their primary care physician if they would like.
And they can always come back to us. If they say no initially, think about it, see their primary care provider for the next visit and say, I'm ready to give it a try, we'll be there.
So you talk about sort of this, it takes some leadership, I think, to take on an endeavor like this, and not just in recognizing you've got to chart ahead on territory where maybe payments aren't supporting that territory, but you also have to put the systems in place and keep the records and communicate, and that's a whole another level of this that I expect is taking a lot of time and effort from each of you here.
I think that's basically what a lot of those meetings that we've done in the pre-work has been about, is getting all of those pieces together to make sure everything is ready to go.
Yes. And it's bigger than us. There are multiple teams of specialists who are trying to get those systems. Our IT people, our compliance people, facilities. I mean, it really takes multiple people to make sure that we've gotten everything best we can anticipate right.
Well, it's exciting.
It's very exciting.
Yeah.
Yes.
Any closing thoughts?
Well, I think we'd be happy to report back on the success as we've gotten into it, that we're down the line a little further.
Yeah, absolutely. We're just happy to have both of these organizations as partners with Martin's Point in this new endeavor.
That's wonderful. Well, thank you all for coming in. I think that's excellent. I think it's great for the viewers to hear about some of the things that are going on. It's just fascinating to watch the medical delivery system transform around, and I think getting more centered around patients in general, which is where we've needed to go for a long time. And we'd love to have you back to hear more about how it's going as you roll this out.
Appreciate it.
Great.
Well, again, thank you for coming, and thank you all for staying with us. We'll be right back. Are you concerned about the impact of rising healthcare costs on your business? Hello, I'm Joel Allenbaugh with National Worksite Benefit Group. Confused by the ever-changing laws, regulations, and compliance requirements? Struggling to educate your employees on the details of your benefits program? Let our recognized experts at NWBG take the stress and frustration out of these complex issues for you, so you can focus on building your business. Go to our website or give us a call today for a free consultation.
Maine Sense is not just health insurance. This is a new program based on reducing health insurance costs.
The costs were just too expensive. I couldn't put that on my employees with those type of premiums.
Maine Sense is unique because it's an employer-owned health insurance company.
It's the kind of plan that I'd always dreamed of being available.
While companies across the country struggle with the rising costs of providing health insurance to their employees, Maine employers are taking action.
Well, I think all the other health insurance companies we've been with over the years have brought to us reduced benefits for higher premium, and our employees are looking for something more than that.
Maine Sense is a health insurance program developed and owned by Maine employers in partnership with Martin's Point Healthcare.
This is the first time I'd heard of a health insurance program that aligned the interests of employees, employers, and the healthcare providers.
It is a plan designed around preventive care and reducing the overall cost of healthcare by keeping people healthier, keeping their health insurance dollars in their pockets.
I feel that going with Maine Census empowered our employees. It's given them the tools to make the best healthcare decisions for themselves.
These and other Maine employers are taking a new approach to health insurance. Find out how to join them at mainsense.org.
I think Maine Sense is right for companies that want to take a proactive approach to managing healthcare costs.
This is a win-win for everybody, and we're really excited and looking forward to making this happen throughout our organization.
Hi, I'm Denise Dumont-Bernier, the Director of Workplace Health. Do you want to work with a team of trusted occupational health specialists with many years of combined experience and proven results?
I would recommend Workplace Health because they have high-quality programs and people. They deliver what they promise, they care about our employees.
Do you want a healthier and more productive workforce?
CMALME has reduced its workers' compensation premium by 60% in the last 3 years.
Our employee wellness program, which is run by Workplace Health, has kept our healthcare costs flat for over 3 years. This has saved millions of dollars for Maine General Health and all of our employees.
You will get timely appointments for your pre-placement or DOT physicals. You can expect direct contact with our doctors and nurses and emailed results immediately following care at our practices. Join hundreds of other businesses in the Greater Kennebec Valley and call Workplace Health, a department of Maine General Medical Center, to be your partner in health.
And now our perspective. Well, pretty interesting conversation. We've been looking at a lot of different payment reform initiatives, and I think it's pretty easy to recognize that the way the healthcare delivery system is currently serving us, there's a lot of room for improvement, and a real need to get focus on patients and put them really at the center of the care equation. And part of that is really also getting the primary care at the center of that equation. We've been hearing this concept of patient-centered medical home, an opportunity for a patient to work with a primary care physician but have a team of professionals around them that they can access. This is one example of that happening. One of the interesting takeaways that I have from this is that as different groups, and locally, Sweetser, Spurwink, Martins Point, are tackling these types of endeavors, it really takes a level of leadership and a level of vision, because oftentimes the path that they're charting and where they're headed with their care models are not necessarily supported by their payment models. Meaning they need to step out on a limb a bit and really focus on what they think is the best care model for the patient, with the expectation that in the end, the payments will catch up. This is something I think we're seeing in a lot of different areas throughout the healthcare delivery system. This is one example. But thankfully, we have that type of leadership. We have that type of leadership and visionary responses right here in the state of Maine. And that's our perspective.
Inside Maine Healthcare is Maine's only show dedicated to healthcare in Maine, brought to you by the healthcare industry and business leaders. Inside Maine Healthcare will bring you the practical information you need to understand what is driving our healthcare costs and identify the resources available for you to better manage your own healthcare. Learn how healthcare reform, new laws, and policymakers impact Maine business and consumers. Find out what business can do to offer affordable, comprehensive healthcare. Join us as we discover and implement innovative solutions to Maine's complex healthcare challenges to provide Maine people more affordable, sustainable, results-driven healthcare.